The President's Malaria Initiative put together 4 proven treatments and interventions that work together synergistically between bed nets, indoor residual spraying, treatment of pregnant women, and combination treatment of people who have malaria. And they have shown in various areas that they really dramatically work. You can bring down malaria cases, incidents, 95%, bring down deaths to almost 0. And the big challenge is to roll that out and to scale it up over the next 5 years and to take it from the countries that we're working in to a lot of other countries, the 2 biggest challenges being, of course, Nigeria and Congo. But I do think that the big challenge here is scaling up proven treatments. Well, this is a partnership, and legitimate governments have to help us in getting it out. They have to help us in keeping people doing these efforts. It's coordination, whether it's the supply chains, making sure that things are unloaded efficiently from the ports, getting out to small villages hundreds of miles from the ports. That's the whole challenge. And also, in many countries, they provide the healthcare workers who are, as it were, the last mile, who actually test people, whether they have malaria, treat them, distribute the nets, put them up. We provide a lot of assistance, both in terms of commodities, in terms of technical assistance, in terms of supply chain advice and monitoring. But in the end, it's their country, and they actually have to get it out to the people and keep encouraging them through public education campaigns and other means. There are 3 or 4 very good reasons. The first one is Americans do what's right, and helping people in the world that can be saved through very cheap interventions is doing what's right. Second, there's obviously a global strategic interest. Having malaria around the world, having people die, having economic output decrease because of malaria is in no one's interest, and it makes states unstable and makes regions much more politically volatile. That's not in our interest, and we definitely need, as we can see around the world, more stability rather than more instability. And last, I would say is, we've seen a lot of emerging infections, a lot of unpredictability in terms of health. What's in Africa, what's in Southeast Asia doesn't necessarily stay there. While it's true we don't have many malaria cases in the United States, mosquitoes and mosquito-borne diseases are very common, and part of the malaria control effort extends well beyond malaria. We've seen knock-on effects, positive effects in other conditions, and this is part of our comprehensive strategy for decreasing the health risks for Americans. And so I think whether it's altruism, whether it's strategic, whether it's health-related, we have many good reasons in this country to really support our global health efforts in general and our anti-malarial efforts in particular.